Lymphoma is an oncological disease. Look at this picture. Tumors and disease mechanism and findings. CT, MRI findings. Look at this detail going on. Introduction. Lymphoma is a type of cancer that originates in the lymphatic system, which is crucial part of immune system. It involves the abnormal growth of lymphocytes, a type of white blood cell. Leading to tumor formation in the lymph nodes, spleen, thymus, bone marrow, or other organs. Lymphoma is broadly categorized into two main types: Hodgkin lymphoma and non-Hodgkin lymphoma, which differ in how they spread and respond to treatment. Definition. Lymphoma is defined as a group of blood cancers that develop from lymphocytes. These abnormal lymphocytes can multiply uncontrollably and form masses or tumors in lymphoid tissues or other organs, impeding the body ability to fight infection and disease. Types. 1. Hodgkin lymphoma, characterized by presence of red stump cells, the type of abnormal lymphocyte. Subtypes include 1. Classical Hodgkin lymphoma, most common. 2. Nodular lymphocyte, predominant Hodgkin lymphoma. 2. Non-Hodgkin lymphoma, a diverse group of blood cancers, further classified based on the type of lymphocyte, B cells or T cells involved. Common subtypes include diffuse large B cell lymphoma, 2. Follicular lymphoma, 3. Burkitt lymphoma, 4. Mantle cell lymphoma, 5. Peripheral T cell lymphoma. Causes. The exact cause of lymphoma is often unknown. However, certain genetic mutations and immune system dysfunctions can contribute to the abnormal proliferation of lymphocytes. Some factors that may play a role include: 1. Genetic mutations in lymphocytes. 2. Viral infections. Example: HIV and Epstein-Barr virus. 3. Chronic immunostimulation or autoimmune diseases. Risk factors. 1. Age. Lymphoma can occur at any age but is more common in old adults or young adults. 2. Infections. Certain infections like Epstein-Barr virus, T lymphotrophic virus increase lymphoma risk. 3. Weakened immune system. Those with HIV/AIDS, organ transplants, or immunosuppressive therapy are at high risk. 4. Autoimmune diseases. Conditions like rheumatoid arthritis and Sjogren's syndrome can increase the risk. 5. Family history. A family history of lymphoma can elevate the risk. 6. Radiation exposure. Previous radiation therapy may increase the likelihood of developing lymphoma. Complications. 1. Infections. As the immune system is compromised, recurrent or severe infections are common. 2. Secondary cancers. Chemotherapy or radiation may increase the risk of secondary cancers. 3. Bone marrow failure. Due to cancer infiltration or treatment, patient may develop anemia, leukopenia, or thrombocytopenia. 4. Tumor lysis syndrome. A potentially life-threatening condition from rapid cancer cell destruction due to treatment, leading to electrolyte imbalances. Pathophysiology. Lymphoma develops when genetic mutations in lymphocytes, B cells or T cells, cause them to grow uncontrollably. These malignant cells evade normal immunoregulation and accumulate in the lymphatic tissues, forms tumors. As the disease progresses, the abnormal lymphocytes may spread through the lymphatic system or bloodstream, affecting other organs. 1. Hodgkin lymphoma, characterized by the presence of red Sternberg cells, large abnormal B lymphocytes that typically initiate in a single lymph node and spread in an orderly fashion. 2. Non-Hodgkin lymphoma involves a more diverse group of malignant lymphocytes which spread in less predictable manner. The pathophysiology of lymphoma involves a series of steps leading to the development of progression of the disease. Here is step by step breakdown of process. 1. Genetic mutation in lymphocytes. Second step, uncontrolled cell proliferation. 3. Impaired apoptosis, cell death. 4. Formation of tumors. 5. Impairment of immune function. 6. Spread through the lymphatic system. 7. Disruption of normal organ function. 8. Development of systemic symptoms. Nine. Metastasis. In some cases, the step-by-step process highlights the complex nature of lymphoma development and its impact on the immune system and overall health. Signs and symptoms. 1. Swollen lymph nodes, often painless, typically in the neck, armpits. 2. Fever, often intermittent and unexplained. 3. Night sweats, profuse sweating during sleep. 4. Weight loss, unintentional weight loss is common. 5. Fatigue, persistent exhaustion unrelated to activity. 6. Itching, especially in HYGIENE lymphoma. 7. Abdominal or chest pain due to lymph node enlargement in these regions. Diagnosis. 1. Physical examination, checking for swollen lymph nodes. 2. Blood test, complete blood count to assess for abnormal cell counts. 3. Imaging, CT, PET and MRI scan to detect tumors or lymph node enlargement. 4. Lymph node biopsy. The definitive diagnosis involves removing a lymph node or a part of it to examine the cell under a microscope. 5. Bone marrow biopsy to check if lymphoma has spread to the bone marrow. Nursing diagnosis. 1. Fatigue related to cancer and treatment regime. 2. Risk for infection due to compromised immune function. 3. Anxiety related to diagnosis and uncertainty about the treatment outcome. 4. Imbalanced nutrition, less than body requirements related to chemotherapy, induced nausea. Management. 1. Monitoring, regular assessment of lymph nodes, CBC levels and organ function. 2. Preventing infection, implementing strategies like strict hand hygiene and monitoring for early signs of infection. 3. Symptom management, addressing side effects like nausea, fatigue and weight loss with appropriate interventions. For psychosocial support, offering emotional support, education, and referrals to counseling services. Treatment 1. Chemotherapy. The most common treatment for lymphoma used to kill cancer cells or stop their growth. 2. Radiation therapy. High energy radiation is used to target and shrink tumors. 3. Target therapy. Drugs like rituximab target specific proteins on cancer cells, reducing side effects on healthy cells. 4. Immunotherapy enhance the immune system's ability to fight cancers. 5. Stem cell transplantation. High dose chemotherapy followed by a stem cell transplant can restore healthy bone marrow. 6. Surgery. Rarely used but may be necessary to remove localized tumors. Psychosocial medicine 1. Counseling and support groups. Psychological counseling, support groups, and cancer survivor network provide emotional support. To education, educating patients and families about the disease, treatments, and possible side effects helps reduce anxiety. 3. Palliative care. For advanced lymphoma, palliative care can improve the quality of life by managing symptoms like pain or fatigue. Prevention. While there is no sure way to prevent lymphoma, certain strategies can lower the risk. 1. Avoid infections. Protect against infection like HIV or EBV. 2. Maintain a healthy immune system. For people with autoimmune diseases or on immunosuppressive therapy, close monitoring is essential. 3. Healthy lifestyle. Regular exercise, a balanced diet, and avoiding non like smoking can reduce cancer risk. Conclusion. Lymphoma is a complex and varied group of cancers that affect the lymphatic system. Early diagnosis and advances in treatment, including chemotherapy, radiation, immunotherapy, and stem cell transplants, have improved outcomes for many patients. Ongoing care, psychosocial support, and prevention of complications remains crucial components of lymphoma management. Thank you. Have a nice day.